Good day, fellow learners. This is your mentor, your fact check buddy Ray Gapuz, joining you for case number 45. So, before we get to start, let me first ask you to please join us in this mission. Our goal is to provide free NCLEX RN application and review to 500 nurses. And to help us achieve this goal, just watch and finish the ads in our videos, and please don't skip. And share this video to at least 10 of your friends, and we'll pray for your success in your upcoming next generation NCLEX exam. So before we get to start, let us learn from the success recipe of Joseph Adrian Pingham. And he actually gave me this message one morning. He sent me this. Good day, Sir Ray. First of everything, my heartfelt thanks to you and to your team. I took the exam on July 1. That's just a couple of days back. And very proud to say that I passed, sir, because of your paulit-ulit na tips. And that's what he's saying, the tips that I gave repeatedly, and my exam stopped at 85. He is a proud 85er. And of course, he gave us a very nice review, and I'd like everybody to learn from it. What I love about RAGRS is its conducive learning environment. They are really serious about making sure that students will get what they paid for. Phones are not allowed inside the lecture room and simulation room, keeping everyone focused. Lockers are provided for safekeeping. Very clean and fragrant comfort rooms and overflowing coffee. Excellent mentors, all NGN passers, and of course, Dr. Ray Gapuz, the best in the business. He's been teaching NCLEX for decades and is not stopping, helping aspiring USRNs reach their dream. His unique style of teaching makes learning fun, that it motivates you to attend classes. Overall, I highly recommend RAGRS. Thank you for the very honest description of a great experience you had with our team, Joseph. We wish you well as you continue your journey into your nursing career. Let's learn from that experience. So you have to know what to look for when you're attending NCLEX RN classes. You have to have a conducive room. You have to have a complete set of learning tools. We all have that at the Ray A. Gapuz review system. So on to our case number 45. And this is known as Menkes Syndrome or Menkes Disease. Now, what should be the first thing that comes to your mind related to this disease or syndrome? Remember, this is about deficiency in copper in the body. To contrast it with your Wilson's disease is about accumulation or having an excess amount of copper in the body. Both are genetically transmitted. The difference is Menkes syndrome or Menkes disease is X-linked recessive, whereas your Wilson's disease is autosomal recessive. What does that mean? Menkes syndrome, being X-linked recessive, is transmitted by the mother to the son. So it's most common among boys. Whereas your Wilson syndrome, which is transmitted through autosomal recessive pattern, simply means that both parents must be trait carriers, so that there's a 25% chance of their would-be children to have the disease and 50% chance to become trait carriers. So the important thing they have to remember is that people with Menkes syndrome as well as Wilson syndrome needs to consult with a geneticist for them to understand how the disease is transmitted. Now, Menkes syndrome or Menkes disease is a rare genetic disorder. It's transmitted X-linked recessive genetic disorder with faulty copy of the ATP7A gene. And once again, to compare that to your Wilson's disease, in Wilson's disease, you have a faulty copy of the ATP7B gene, where the body has trouble absorbing and using copper, a mineral needed for brain and nerve health. Therefore, primarily, the brain gets affected in a client with Menkes disease or Menkes syndrome. So babies with this condition may have weak muscles. They are prone to seizures and problems with growth and development. And if you'd notice, take a look at the hair. It's kinky, sparse, or brittle hair that looks and feels different. So it mostly affects boys, and the symptoms usually start a few months after birth. It is caused by a gene problem passed down from the mother. That's why it's X-linked in terms of inheritance pattern. Is it life-threatening? It is. And early diagnosis is very important for the provision of the child's supportive care. Now, skin and hair abnormalities are the most striking signs in Menkes disease or Menkes syndrome. You'll see kinky, brittle, and depigmented hair. It's the most distinctive physical sign. And here, we have here on figure 1, the skin and the hair appearance of a patient with Menkes disease or Menkes syndrome. You have hypopigmented skin with short, sparse, coarse, lightly pigmented, and kinky hair. And if you're going to take a look at the hair underneath a microscope, you'll see trichorexis nodosa, or you will see nodes along the hair shaft that makes the hair brittle and it's easily destroyed. So that's one of the characteristics of MD or Menkes disease. So the outstanding features of Menkes syndrome or Menkes disease include your trichorexis nodosa, nutty weak hair that breaks easily, the absence of the blink reflex, which is due to a neurovisual impairment, and of course, normal reflexia. Although normal reflexia means normal reflexes, and you would think, how come? Because the brain is usually affected in Menkes syndrome or Menkes disease. It's because the normal reflex response usually occurs in the early stages of the illness. So remember, TAN, trichorexis nodosa, absent blink reflex, and normal reflexia. TAN, outstanding features of Menkes syndrome. Now, the diagnostic highlights of Menkes syndrome include, remember the code, the acrostic Menkes, missing copper, that's the letter M in the body, causes brain and nerve problems. E, early signs appear in babies, so this would include weak muscles, seizures, slow growth, not absorbing copper properly due to faulty gene, that's ATP7A, and then kinky brittle hair, which is an outstanding feature. And E, exam and genetic testing confirm the diagnosis. This could either be done through blood or saliva as your specimen, and then supportive care and early treatment can improve life quality. So you just have to know what the deficits are, and therefore you have to implement a set or a bundle of interventions to improve on the quality of life of the patient. Now, the main nursing priority, this is a functional concept for a child with Menkes syndrome, is to promote comfort and prevent complications through supportive care. And what does that entail? Now, due to the hypotonic muscles or weak muscles and the laxity of joints, these children are prone to injury like joint dislocation. Therefore, applying padding at the elbows, the knees, the ankles, the wrist, and the sides of the crib or wheelchair would definitely make some difference in terms of preventing or decreasing the risk for injury. Now, what are the treatment modalities for Menkes syndrome? The treatment includes the following. So first and foremost, we need to monitor the child for seizures and breathing difficulty regularly, and the medications for these symptoms must be provided by the physician. We need to administer medications like anti-seizure drugs and copper histidine injections that we're going to discuss in detail in a little while. Nutrition support to careful feeding or tube feeding when needed because the child is prone to seizures. Assist with mobility, and definitely you need to pad their joints and provide physical therapy for weak muscles. Guide the family with education, emotional support, and home care tips, especially when they're the ones administering the medications to the child. And evaluate growth and development and report any decline or potential red flags for complications. Now, let's talk about the copper histidine treatment. The medicine appears blue in color. It is placed in a small sterile ampule like a tiny bottle with 250 milligrams in 0.5 ml administered twice a day. Now, the ampules are kept cold at 4 degrees centigrade and stored in light protective bags to keep the medicine stable. Now, these medications usually administered subcutaneously. Now, discharge instruction to the parents of a child with Menkes syndrome include how to clean the skin and safely inject the medicine. Remember, subcutaneously. Now, how do we use the concepts or the functional concepts which we learned? Our book, NCLEX RN 311, would definitely give you an opportunity on how to connect functional concepts with questions in the test. When you say functional concepts, it could be a single word, a phrase, a sentence, or even an entire paragraph that gives you a sense of direction on how you deconstruct a specific question on NGN. So some of the feedbacks that we got, it says here, parang actual, parang reflection po talaga, sir, of the QUICKFIX YouTube and 311, yung questions that I got. So happy I got through the exam successfully. Thank you po, sir, ng marami. What this NCLEX 311 user is saying is that the questions she got from her test were a reflection of the QUICKFIX, which is a 3-day program with me, the YouTube N311, YouTube videos, the one you're watching now, and of course, NCLEX 311. And then Shin says, also came out. I was like, Sir Reno, what topics would come out? I'm glad I'm a Gapuz baby. And another one saying, amazing. Sincerely speaking, if it were not for NCLEX 311, I would not have passed. I went through it the last 4 days of the exam. This should be the last book that you should read if you want to pass NGN. The book is amazing. Keep up the good thing of helping us nurses. NCLEX 311 po, the best. This is what she's saying in Tagalog. Halos same na same po siya sa pagkakakonstruct sa mga na-encounter ko po, mga standalone questions. Or what she's saying is that the way of the questions, the sample questions on NCLEX 311, the way how they were constructed, were almost the same on how questions in the actual test were constructed. Thank you very much for looking at the legitimacy of the content of NCLEX RN 311. And of course, I'd like to share with you the oldest NGN passer in the world, Miss Flor Villarreal, proudly mentored by yours truly, Ray Gapuz. And she passed the test last December 2, 2024. Now, let's apply what we learned by going through a case. We have here a patient, male infant, 4 months old, referred for further evaluation due to the presenting signs to be, as presented here, seizures and developmental concerns. That will not tell you about Menkes Syndrome right away, because the presenting symptom would just be seizures. So the way to deal with this type of case is to read through it and reflect on every single set of data that you'll need. Okay, so let's go over the history. The infant was born to non-consanguineous parents, history of generalized tonic seizure and nystagmus since age 1.5 months, currently on phenobarbital. So we have an anti-seizure medication, referred at 4 months old with hypopigmented skin. There you go. Kinky hair. There you go. Subtle flexor spasms. There you go. That should give you a clue. And then we have here hair microscopy revealed. There you go. Trichorexis nodosa, one of the outstanding features. Anthropometry indicates severe protein energy malnutrition, and definitely ophthalmological exam reveals brown iris, clear cornea, sharp disc, flat retina. Absence of blink reflex could be a red flag that you may want to consider at this point. And then you have the neurological findings. So the infant appears lethargic. So that could be due to weak or hypotonic muscles. And then, of course, the second finding, hypertonia of limbs and hypotonia of trunk. That should also give you a clue, okay? And then we have normal reflexia, okay? That would tell you that this could be in the early stage of illness. And then you have myoclonic seizures, responds to voice, maintains brief eye contact, unable to roll over. That could mean very weak muscles, okay? Okay. And then head lag present. Other systems, no remarkable findings. And the plan of care includes this: continuous seizure management, initiate nutritional support, monitor neurodevelopmental milestones, support diagnostic workup for suspected metabolic or genetic disorder, likely Menkes syndrome. Now you got the clue on the last word, and that's very typical of the NGN. Pay particular attention to this tip I'm going to tell you. Read from the first letter up to the last period. Who knows? You might get some clue. Okay, so since this is a genetically transmitted disorder, it's also important to know the history of the child. It says here that the infant was born to non-consanguineous parents. That means that the child was born from couples who are not biologically related. And that is a good thing to consider because your Menkes syndrome or Menkes disease has a genetic basis. Okay, so now let's go through case number 45. A 4-month-old male infant with non-consanguineous, meaning non-biologically related parents, is referred for the clinic for further evaluation. He has a history of generalized tonic-clonic seizures and is diagnosed since 1.5 months of age, is currently on phenobarbital. On assessment, the infant presents with hypopigmented skin. There you go. That's outstanding. One of the outstanding features. Kinky hair, another one. Trichorexis nodosa, subtle flexor spasm, severe protein energy malnutrition, absent blink to light, limb hypertonia, truncal hypotonia, and head lock. Which of the following conditions most consistent with these findings? Shall we consider it Tay-Sachs disease, Menkes syndrome, Zellweger syndrome, or infantile spasm or West syndrome? As we discussed, this is clearly Menkes syndrome or Menkes disease. But the way to study this case is to go over the other options which are not related to the answer and try to reflect how come these are the options. Maybe the other conditions that are mentioned here, contained in the other options, have some similar signs and symptoms as that of a patient with Menkes syndrome or Menkes disease. Okay, so Tay-Sachs disease typically presents with hypotonia or developmental delay. This is also genetically transmitted, and the outstanding manifestations would be your cherry red spot on the retina, but there's no kinky hair or copper-related features. What you would notice in a child with Tay-Sachs disease is that they have overreactive motor reflex. Remember that motor reflex should disappear at 3 to 4 months, but for Tay-Sachs disease, it goes beyond that. So if you have a hyperactive response to startle reflex at 6 months, that could be a potential indicator that the child could be having Tay-Sachs disease. Once again, hypotonia is a feature of Tay-Sachs disease that's similar to Menkes disease or Menkes syndrome. Zellweger syndrome is a paroxysmal disorder that may cause hypotonia and seizures, but lacks the hair abnormalities and copper transport issues seen here. Now, paroxysmal, actually, these are like the cleanup enzymes in the body that gets rid of toxic substances or fats that were not metabolized properly. So when you have a paroxysmal disorder, you don't have that cleanup device. So in essence, toxic materials accumulate in the body, leading to seizures, okay? So hypotonia and seizures are present in Zellweger syndrome in the same way as these symptoms could also be manifested in Menkes syndrome or Menkes disease. However, the hair abnormalities are not present in Zellweger syndrome. So Zellweger-like facial appearance, you see in the picture, you have a large forehead, flat face, low muscle tone, and these are common in severe paroxysmal disorders. Okay, now, infantile spasms or West syndrome may present with seizures. Seizures also may occur in clients, specifically during the late stage of the disease, Menkes syndrome, okay, as well as your Tay-Sachs disease and developmental delay, but not the distinctive hair and metabolic features of Menkes syndrome. So once again, what differentiates infantile spasm is the absence of the distinctive hair and metabolic features of Menkes syndrome. So infantile spasm is a rare and severe form of epilepsy in infants and primarily caused by either structural abnormalities in the brain, genetic mutations, or metabolic disorders. So to summarize, the unique feature of Menkes syndrome or Menkes disease would be the kinky brittle hair due to copper deficiency. Pay particular attention to that. If you get to see that right away, think Menkes disease. And then for Tay-Sachs disease, you have your cherry red macula and exaggerated startle response or motor reflex that remains active beyond 3 to 4 months. And then Zellweger syndrome, we have craniofacial features, liver as well as kidney involvement. And your West syndrome, which is your infantile spasm with hips arrhythmia on EEG, and pay particular attention to the fact that in a patient with West syndrome, they would usually have seizures. And the most important thing that you have to remember about these seizures is the fact that it may also occur in clients with Menkes as well as your patients with Tay-Sachs disease. Okay, so what matters the most is you know how one of those diseases that were mentioned in the options differ from one another. Okay, now pay particular attention to the EEG pattern here. It says hips arrhythmia, which simply means that there is chaotic EEG pattern. Okay, so it reflects a very chaotic wave that could be related to strongly associated with infantile spasms. Okay, and that occurs with a rare form of a seizure disorder known as West syndrome, rare form of epilepsy. So with that, you are invited to visit us. This is our simulation room at the Ray Gapuz review system. And this is where we conduct our QUICKFIX classes, very comfortable rooms. And we pride ourselves with very comfortable classrooms for our large classes. And of course, our very clean restrooms. And they're really called comfort rooms. We live up to that. And of course, may I invite you to join our 27,700, we're not 27,700 members or subscribers of our YouTube channel. Please join our growing community and be part of those who gets to watch our videos first. So we also have a promo, get a free review from us if you process your NCLEX RN application with iTaps Gapuz. Once again, free NCLEX Next Gen review if you process your NCLEX application with iTaps Gapuz. You can give us a ring at 0955-658-5891. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying good luck to your test. And I know for a fact you will see Menkes Syndrome or Menkes Disease or Wilson Syndrome in your test. That's one thing I'm sure of at this point. So subscribe, hit that like and bell notification button, and share this to your friends so that you can help them pass the test. Take care. See you in the next video.